Okay, so good afternoon, everybody. I'm Tess Korda, as Tammy was saying. I'm an emergency physician working in KZN at the moment. I finished my reg time 2 years ago in the VIT circuit. And prior to that, well, actually before medicine, I took the long way around and did a BSc in biomed with honors in medical criminalistics, which led me down my windy route in forensics, where I worked for the SAECK in the forensic science laboratory for just under 4 years. For the first year of it, I worked in the actual laboratory and opened a good couple of thousand sexual assault kits, which was rather dismal because it completely jaded my view of doctors and healthcare professionals as the intelligent people I thought they were. The sexual assault kits we were opening were really, really, really badly collected. Things weren't sealed. And a lot of cases actually just got kicked out of court or didn't go through. Our evidence was worth nothing because of how poorly they were actually collected and actually done. So one of my missions is to make sure that you are all competent and able to collect a sexual assault kit. I'm not going to walk you through step by step because the kits change quite frequently, but I want you to grab a couple of concepts from this talk. In terms of forensics, in terms of why your role is so important. And if you understand those, I really do believe that you'll be great at collecting kits in the future. Okay, so let's get into it. Okay, so why is this a really, really important thing for us to talk about? Well, as you all know, South Africa has one of the highest crime rates in the world, sexual assault being one of our most common crimes. And the amount that's actually reported is probably less than about a third of what actually happens. So for us to be right up there, leaders in the world in terms of sexual assault, and only be reporting less than a third, means that the problem that we're dealing with is actually just massive. And each of you has a role in tackling this. It's not something that's going to be tackled easily, but it's something that every single role player in this entire chain has to take seriously and has to be good at, because one weak link in this chain and we're losing the battle completely. And if it is something that hits close to home, you realize how important it is. Our crime stats, you can see the thousands and thousands of rapes and sexual assaults growing year upon year. And these are quite old stats. Our newer stats are actually much higher. So some really, really disturbing headlines you can see here that would be what motivates you to do your part and really take this quite seriously. The reason our role as emergency physicians or frontline workers or people who take the sexual assault kits from these victims is so important is for this bunch of information here. So a lot of psychological studies have been done on our criminals and criminals worldwide. And we actually will have a really good psychologically motivated crime unit in the country that has looked into a lot of this. And our criminals actually tend to reoffend. So 90% of our rapists and 50% of our armed robbers have a previous conviction. So if we had caught them first time round, second time round wouldn't happen. Okay, so you are actually preventing massive crimes here, hectic crimes. The severity of the crimes that are committed tends to increase with time. We know that most of our serial killers will start with a basic assault, maybe progress to sexual assault, and then eventually murder, rape and murder, and so forth. So if you can catch them in those beginning phases, the number of lives saved is huge. One rape victim in the emergency department or sexual assault survivor in the emergency department isn't only one patient. It's all the people who are going to be affected from that point on. Excuse me. So a number of criminals are often responsible for numerous crimes, and we actually have a really, really good DNA database in the country. So if you can take DNA and get positive samples from one person, you can actually link it to multiple cases. So you can see how important this one person sitting in front of you is. Okay, so where do we start? Well, the first step that I'd recommend is that every department has protocols in place for the sexual assault survivor. This is something that possibly one day as consultants you're going to do, or even as medical officers, ask what the protocols are in the department you're working in and make sure that you are aware of them and see if you can improve on them. All of that is going to make a huge difference in somebody's life. We need to identify the survivor, and there needs to be a method of this. So your triage nurses need to be aware of what your policies are, of what the procedures are, and be able to discreetly come and tell one of the healthcare workers that there is a sexual assault survivor. These shouldn't be the patients who sit in the queue for hours upon hours. This really is a time-sensitive matter. Our DNA evidence starts to deteriorate, degrade immediately, and we actually really, really need those samples to be of a good quality in order to get something out of them. So please identify them early, take them to a safe space, make sure that you're always preserving dignity. This isn't a woman who should be, or a man who should be sitting amongst a whole bunch of other people who may be drunk, who may be victims of our massive trauma weekends, of our derby days. They should be identified, taken somewhere else, somewhere quiet. And even if you are unable to examine them immediately, just get them somewhere where they aren't experiencing secondary trauma. Okay. As you'll see, when we go through this, your documentation is paramount. Your documentation is absolutely everything. You need to, from the time you start seeing them, document everything you do and everything they say. Okay. Remember that the first step in the care is emergency care. Sexual assault can often be a distracting injury. I know we think of our massive bleeding arteries or our femur fractures as our distracting injuries, but sexual assault is actually also one. Remember that the victim has probably experienced physical assault as well as sexual assault, and it's your job to do your primary survey and a full trauma survey and exclude any critical injuries before you continue and investigate the sexual assault. Okay, they should all get a pregnancy test, and every department should have PEP guidelines, and you should be assessing whether or not the patient needs ATT. And only after we've considered all of those will we consider going ahead with investigating our sexual assaults. Okay, so this is a table out of the article listed below. There isn't a lot of resources available on exactly how to carry out these kits, of what's expected of you, and kind of what the overall picture is of this entire chain, which is probably part of the reason why there is a lack of understanding of what our role is and how important it is in taking these kits. But this is one of the articles that has some of that stuff in, and particularly it has how to treat the survivor in. So even if you can't examine them immediately, there's a lot of advice that you can give to them prior to examining them. Because if they are sitting and waiting for you, they may need the loo, they may want to go and urinate, they may be asked to go and urinate for their preg test or for their dipsticks. Please ask them not to wipe their vulva after urination. Please ask them not to wash, not to shower. Ask them about clothes or condoms or bed sheets that may be involved. In this case, you can inform the investigating officer or the police who are bringing you the kit, or ask the patient's family to preserve it at the scene. They should avoid eating, smoking, drinking, chewing bubblegum, especially if any oral penetration has taken place, and avoid defecation if at all possible. So these are some of the things, as you identify the survivor, to let them know discreetly, and then you can carry on with what you need to do until you're ready to take your kit. Okay, so we've talked about your post-exposure prophylaxis. I'm not really, and these change as our PEP changes. STI prophylaxis, same story as with the PEP. please follow your protocols. As with emergency contraception, each department has different available contraception, so you aren't going to learn exactly what to give. Know what you have in your department. And please don't forget things like antiemetics and the analgesia, especially when you are giving the STI prophylaxis. The flagyl can be quite pro-emetic. Okay, so where do you get your sexual assault kit from? If you're lucky enough, your patient is going to arrive with one, as they will have already opened a case with the SAPS. But if they arrive as a fresh new patient who hasn't been via the SAPS and they're now in the emergency department, what do you do in order to get it? Well, the first step that I'd recommend to you is that you actually figure out what kits you need. Okay. The kits are ever changing. The current kits are still in the form of the D1, D2, D5, and D7, and you should know which one you need for each situation. Okay, so you have an adult sexual assault kit, there's a pediatric sexual assault kit, and then there are extra swabs, which you would find in the D2. Okay, and this is because our sexual assault kit only has 3 swabs at the moment, and you can ask for a clothing kit. And this is really important if the woman or the man tells you that there was ejaculation on their shirt, on their pants, on a towel, or anything like that. You would use that to then collect any larger items of clothing. So find out this history before you ask the SAPS to bring kits so that you can ask for the appropriate kits, as most of these kits should be stored at all of the local police stations. Okay, so who do you then call? So you first need to find out where the incident took place, because you will have to call the SAPS that is serving that area. Okay, if you call any other SAPS, they probably aren't going to help you. So Google Maps is your friend in this regard. Find the police station closest to where the victim describes the incident having taken place, and you can give them a shout. If you have relationships with the police stations that are around your hospital, you may have numbers for these police stations already, or you may have a direct cell phone for an FCS member that you can call. Okay, when you get hold of somebody at the police station, please take their name, their personal number, and document it. Document the time you phoned and ask them for an ETA and document that. Okay, so when this goes to court, if there are massive delays, they're going to be pinned on you if you haven't actually documented that you repeatedly asked for these kits, the time you phoned, etc. No one's going to take the fall for you if they don't need to. Okay, when you do phone, there is a very good chance that you're going to get an admin clerk who may then just send a driver with a kit. This is not going to help you. Okay, you need an actual investigating officer to bring the kit so that you can have a CAS number and so that there's somebody to actually collect it from you at the end of it. Because as you'll find out as we go along, the chain of evidence is crucial. So if at any point we can't account for where this evidence is, how it has been secured, how it has been locked up, this case is useless. So the kit needs to be brought by an investigating officer or a member of the SAPS so that they can then collect the kit from you and there can be a sign over, okay, so that we can account for this entire chain. So when you phone and ask for the kit, please tell them that you need somebody to come and take a statement, okay, somebody to open the case and somebody to bring the kit. So please not to just send a clerk with a kit, okay. Okay, as I said when I opened, one of the most important things you're going to do in this process is your documentation. It needs to be detailed, it needs to be objective, and it needs to be legible. Okay, please, legible. Okay, put it in the file and the J88. Okay, your J88 may go missing, and all you have is the file, or the file may go missing, and all you have is the J88. Give yourself a backup. Okay, future you will be really, really grateful if one of the two is missing. Okay. If the victim gives you exact quotes, put the exact quotes in. If they're able to describe anything, describe it as they've described it and write down that this is how they had described it. Okay, a lot of this will be able to go to court, and sometimes this is actually the only history that the court will get, is what you describe in your notes or your J88 when you testify. Okay. Your history is also going to be your guide to your clinical exam. We're going to come across the concept of evidential value in a little while, And you're going to realize that your clinical exam is what's going to guide how you document everything and what samples you take. And it's your clinical exam and what you take that's going to dictate which samples are sent for DNA testing. Okay, so you play a pivotal role in this case going forward. Okay? Even after you have finished and it ends up at the laboratory, what you have done is still playing a pivotal role in the future. Okay. Describe the injuries and the clinical findings using the correct medical terms. I cannot stress this enough. I was in court last week for a J88 that I had to put in for a medical officer who left us. And the defense had picked up that the medical officer had interchangeably used the terms laceration and incision. Okay. These are two very distinct, different terms. The injuries, the entire case was null and void by the end of it because the judge actually ended up asking me if in a medical school exam, this person had written the definition of laceration under incision and vice versa, would they have passed that exam or that question? And my answer had to be no, they would not have. They are two different terms describing two different things. And that was the case done. Okay. So what you write matters. Know your forensic terms. Please use them appropriately. Okay. Preparation is everything. Please don't just walk into a room with the kit and the patient and figure it out as you go along. Prepare, prepare, prepare. Okay. You need a space to examine the patient. It needs to be private and it needs to be dignified. Please don't take them into a storeroom that is dirty or a bed that is covered in the last patient's mess. It needs to be better would be a dedicated area for this, but at least have an area that you know that you're going to use every time you have a sexual assault in your department, where you are able to have the space where you can set up, where you're able to bring possibly a light in, where you're able to bring your trolley in, and you're able to bring your equipment in. Okay. And it needs to be private, where everybody who's walking past can't open up the curtain and stop and ask you something. Okay. Inform your colleagues where you're going to be and ask both the nurses and the doctors not to disturb you while you're examining. Okay. Then you're going to have a look at your actual sexual assault kits. Okay. The kits have changed multiple times. Anyone who opened or collected kits many years ago, about a decade ago, will remember, I think there were about 12 swabs in the kit, and they were in these horrible triangular boxes that no healthcare workers were able to fold. So the swabs would all be exposed within the kit, and half the kits would be, the evidence would be null and void because they weren't correctly sealed. So I'm not going to go through what is in every single kit, as it will change. I will go through the basics of what the components should comprise of. You will usually have some paper bags. These are usually to collect your sanitary towels or panties or underwear. You'll have an evidence collection box. This will be for a tampon or a condom. And then you'll have a number of swabs. Currently there are 3, but there may be more or less in the future. Okay, and sterile water is to wet the swabs for any external collection. You'll have swab store boxes to keep them separate. Okay, this is because each swab collected from each different area will have a different evidential value. So we don't want the swabs to touch each other and contaminate each other, because then the evidential value of the one that is most worthwhile will be compromised. Okay, you will have tamper evidence seals. These are to seal your swab guard boxes, and you will have evidence seal bags. Okay, these have a tamper, a built-in tamper-proof seal that will show if anybody has opened it, and the entire contents of your kit is going to go into these evidence sealing bags. There are some desiccants in the kits. You can add these back into the bags once you collect all the evidence. You're going to be kept in storage for many, many, many years. And these desiccants will help to prevent decay. Okay, then there's a J88, your instructional leaflet, and an info sheet. If you do not collect kits very often, or even if you do, I would recommend using the instructional leaflet for every single kit. Okay, it's a step-by-step guide. You aren't going to miss any steps. You aren't going to seal a bag prematurely or seal a box prematurely. And it's just going to make your life a whole lot easier. So please use the instructional leaflet each time you fill in a kit. Okay. Okay, inspect the kit. If the kit is already open or the seals are not intact, you need to request a new kit. Okay, because you need to document in your file and on your JD8 that you opened up a sealed kit, so that we can have proof that there was no contamination prior to you receiving the kit. Prepare a clean surface on which to open the kit. You're going to open it up as everything is numbered, and you can set everything out according to its numbers. Okay. Please use powder-free gloves. The powder in gloves actually prevents the DNA amplification step. If it does contaminate the swabs, we are unable to actually amplify that DNA, which means we're not going to get a decent sample. So powder-free gloves for all sexual assaults, please. Open the kit along the dotted line, empty your contents, organize it, and then position your patient. Okay, your patient should be on a clean bed with linen savers, and have had everything explained to them properly. Okay. Your info sheet, action for the evidence collector. Okay, it's going to be you, the individual, and a section for consent. You're going to do this consent. I would recommend doing your in-house consent on your normal consent form 2, and you're going to have the SAP 308 form, which should be brought with the kit by the SAPS, allows for your medical legal examination. Okay, so three separate sets of consent is what I recommend. Okay, first step, collect the patient's underwear. Like I said, underwear usually goes in the brown bag. Seal immediately, mark immediately, and just use that throughout the kit. If you collect something, you seal immediately, you mark immediately. Okay. There is a wax paper that can be used if you are collecting a sanitary towel, to stick over the sticky side, and this can be put in a paper bag as well, and these can be put in your evidence seal bag. You can see the blue and yellow tamper-proof seal in the evidence seal bag, and you should have a unique number on the seal bag, which you should document in your notes as well. Okay, you're going to document everything that you collected. So what you put in the large bag, what you put in the small bag, and you can see the other section here, for each swab, where you collected it from, and what's in the evidence collection box. If there's nothing in there, or you didn't collect anything in the large bag or small bag, just write nothing collected. Okay, if there is a condom or a tampon, please collect this. This will go inside the box. Again, seal immediately and mark immediately. Okay, and this goes into the evidence seal bag. Please always collect a condom if it is present, as you obviously aren't going to have a very good chance of getting any other victim samples. So you need to make sure that this is collected properly. Okay. Your swabs. Okay, so your swabs are going to differ for males and females. The reason that the kits were changed from having about 12 swabs previously to just the 3 is because it costs thousands of rands for each of those swabs to run through our DNA system. So it was brought down to save on costs, but also because there were multiple swabs and we weren't able to send them all. So now we've got a much larger chance of actually getting something off each swab, as it covers a larger area, but it's still an area that will have the same evidential value for that swab. Okay, so you're going to have an external swab and internal swabs. Remember, your internal swabs are of greater evidential value, as they would indicate that there was penetration. Okay. Your external swabs will only be able to say that there was ejaculation outside of the person, which is why we need to be so careful about how we label everything. And you need to write on the forms that you collected the swab internally or the swab externally and which area it is from, because it will, one, corroborate the victim's history, And two, if it is internal, as I said, it will prove a lot more evidence than external swab. You're going to use a speculum and a dry swab internally. And then, as I said, for any external areas, you can use the sterile water that is provided. Okay. Please note, I'm talking through an adult kit at the moment. Pediatric kits should be done by somebody who is a specialist in this area. They should be done under anesthesia, and they should have pediatricians involved. Please don't use speculums or don't just go ahead and do pediatric kits. Rather contact the appropriate people in this regard. Okay, so the internal swab is going to be your entire vaginal vault, okay, up to your cervix, because this would all have the same evidential value. Okay? It all is within, so it would all prove penetration. Okay, so that's why it's all been included onto one swab now, as opposed to the multiple swabs for each small section within that was previously done. Okay, please make sure that you get a good sample. If you can visualize inside and you can actually see bodily fluid, obviously try and collect that with the swab. Okay, if not, just cover as much of the area as you possibly can. Okay, male's a little bit different. You're going to do the scrotum, the shaft and the glands, and then the perianal area. Okay, if by any chance or for any reason the victim gives you a history of ejaculation in a certain area, please don't blindly just follow what the swabs tell you to do. Go collect from that area and then mark appropriately. So if you feel like you can compromise the perianal swab, for instance, and you want to take from the inner thigh, just write on it, collected from the inner thigh, as the sexual assault survivor described this area within their history as the area of ejaculation. Yeah. So don't just follow the instructions blindly. Like I said in the beginning, your history is going to dictate your exam and your collection of this kit. Okay. Like I said, document all your swabs, seal all the boxes once the swabs are inside, and place the protective sleeves on the boxes and then into your evidence seal bag. Okay. I'm just going to, there's a part that I refer to later in the talk, but I'm going to just throw it in here now because you can see these seals really nicely. If you look on these swab guard boxes, you will see these little areas that you seal with a little seal that has a barcode and a unique number on. When this swab guard box gets to the forensic laboratory, the bag, the evidence seal bag is open. The number from the bag is cut out, stapled into the docket. The seal in its intact form is cut out, stapled into the docket. The swab guard boxes are taken out one at a time. Every seal is cut out. You can see that dotted line, cut out in its sealed form and stapled into the docket. So there is physical proof of every single seal being intact when it gets to the laboratory. So if you have not sealed this properly, if you have missealed this, if your seals are not stuck down properly, it will be cut out and indicated as not sealed, seal missing, and you will have to explain this in court. Okay. This is the same section we went through earlier, where you're going to document exactly what you collected for each area, where you collected swab 1 from, where you collected swab 2 from, where you collected swab 3 from, and it is here if you collected from any other area or switched out a swab for something that you thought was more important, you would document it here as well as on that swab guard box, as well as in your notes. Okay. So by the end of it, you should have your evidence seal bags, the box, the swabs. Okay. If you didn't use any of those, you can put it in empty as not used, or you can just discard it. Okay. You're also going to put your documentation within these evidence seal bags, and then everything should be sealed within one bag. Please complete your J88 form. I can't stress to you enough how important the J88 is. The person opening the kit at the laboratory will often have nothing but your J88 to go on. So the entire history that they put into that docket at the laboratory, the docket that goes through to the reporting officer to decide which swabs to send through for DNA, will be based on what you have written in your J88. Like I said, the concept of evidential value will be used here, but the only way they are going to know which swab has evidential value is if you've written down a complete and thorough history in your JAD and on your sexual assault kit form. So please, as much information as you possibly can within these kits. Okay, your evidence seal bag is going to go, as I said, to the laboratory with the investigating officer. You're going to have put that unique number from the seal bag into your files, that you will have proof of which evidence seal bag you sent to the laboratory, so that if something happens to it along the way, you are covered. Please sign, date, indicate the time you sealed it, and put your patient info, the CAS number, and possibly your hospital number and initials on the evidence seal bag, just as further fail safes to prevent any tampering. Okay. If an officer is present, ask them to write the patient details and CAS number on the bags in front of you, so that you don't get blank bags going to the laboratory. Document all the bag numbers, the kit number, and the seals within your file, and ask somebody, one of the nurses or another doctor, to actually witness for you in your notes that this was the bag you collected and that you handed it over. Keep a copy of your J88 in the file. Another can be stapled onto the evidence seal bag for the investigating officer, and there should be one within it that they're going to use at the laboratory. Okay. The officer must sign acceptance of the evidence on your copy of the info form so that you can keep it. Document in your file who you handed it to, the date, the time, everything. Okay. Please also remember on your J88, etc., to document all your other injuries. So don't stop after the sexual assault examination. Okay. This person is probably going to need a bunch of other referrals depending on what their state is. Okay. Please follow your protocols for how you deal with post-exposure prophylaxis and care. Whether or not they need a social worker or a psychologist, please follow your protocols. I'd recommend that every one of these needs a referral for some sort of psychological support, and decide what specialist follow-up they require. This might be based on their physical trauma or other injuries. Okay, so this part is the part that a lot of people don't really know about, which is why it's hard to understand what your role in the kit is, or how important each step of taking this kit is. I'm just going to go through what happens to the kit once you're done with it, so that you can understand and see exactly what you need to do and why all the things I've just explained are so important. So this entire sealed kit is taken to the biology unit of the forensic science laboratory by the investigating officer. Okay, they're all handed over, signed for. All the seal numbers are documented at a receiving facility so that the chain of evidence is maintained. And then from the receiving facility, they're handed over to the storage facility. Again, every single seal number, every single bag is documented. They're all scanned in, and the entire chain is traceable as to what the path of this bag was. Okay. Please ensure that you write all the correct information on the outside of the kit. Don't mix up kits. So for instance, if you had asked for 2 kits because you wanted to collect clothing and sexual assault samples, please don't open them simultaneously. Do your sexual assault kit and then do your clothing kit, because the evidence bag that belongs to the clothing kit needs to be with the clothing kit. The evidence seal numbers on the clothing kit need to be within that kit. And there should be no cross mixing, because if those seal numbers or those seals are on both kits or mixed up, this case is going to get chucked out. Okay, so each kit must be done separately. The kit is then allocated to an analyst. Okay, it's opened. And like I said, every single marking and seal is cut out in an intact manner and attached within the docket. Okay, so including that white part on the front of the evidence seal bag that you wrote on, it's cut out and stapled into the docket. Every seal of every swab card box, the seals on the paper bags, everything is cut out and put into the docket. Okay, then the swabs are opened one at a time and they're subjected to presumptive testing, okay, which is done for either semen or blood, depending on what your history has dictated. And what type of case this is. So in your case of sexual assault, it would be predominantly semen that we're looking for. And they are then tested with a substance called brentamine. If the swab changes color, indicates possible presence of semen, it's marked as a positive swab, put inside the docket. If the presumptive testing is negative, it's marked as a negative swab, and it's put inside the docket. So we keep all the swabs. This docket is then allocated to a reporting officer. The reporting officer will read your history, will read your JD8, your description. That's often all they have for this case. And they will then have a look based on that, along with which of the swabs are positive, and choose from the positive swabs which one they're going to send through for DNA. So it will be the positive one with the greatest evidential value. Remembering we want to prove penetration or prove rape, and that would be for the maximal sentence or charge. Okay, so this again should show you exactly why your history taking and your documentation is so important, and what the pivotal role you play in every single one of these cases. Okay. These are then sent through the process of DNA amplification, isolation, and analysis. Okay, these can be stored in the docket form for years, as they're quite well preserved in this form. And only when there's a court order or a SAPS request to look for DNA on these swabs, will they then be sent through the system. Usually when there's a suspect or a suspected serial that they want to compare it to. So the results are compared to the victim's control sample, and then you can see if there's any exogenous DNA present. If there is, this will be compared to the suspect's control sample, or it can be inputted into our database. Okay, so the database might then link a bunch of crimes together for which there may already be a suspect, or for which the suspect may still be caught, and then they would be charged with all of these crimes that are linked on our database. Okay, so hopefully this case goes to court. All your documentation, seals, samples, the procedure followed will be scrutinized by the court. You may or may not be called in. Usually, if you've done everything correctly, you will not be needed in court. They will just use your J88. Okay? If there is something that they are able to query, even if it's something like you forgot to sign a page, you'll be brought in for that. So please make sure that each page is signed properly, dated properly, you've used the correct names. Don't have your time wasted for something silly like that. And they will call you in if there's an issue with any of the seals. Okay, so if you have sealed everything correctly, documented everything correctly, completed everything correctly, you have very little chance of actually being called in for these cases. Okay. Please remember that the DNA is amplified. So when you are collecting, you also need to be quite careful. Please wear PPE, aprons, masks, gloves, as I said. You don't really want your DNA to be picked up, stored on a database, or stored as one of the possible suspect samples. Okay, so some of the concepts we've gone through is the chain of evidence. This is what's going to make this case actually get to court and actually get a conviction. The weakest point is the value of this entire case. So if you've created a weak point anywhere along the line, that's it done. So please make sure that everything from the handover of the kit to you, to the handover of the kit to the investigating officer, if you can't do it immediately, document where it is locked up, how it is locked up, who has access, etc. And make sure you have some in every department to lock these things up so that you can always prove your chain of evidence. your documentation is paramount. Like I said, everything will be scrutinized, but also what you have to say is often all they have to go on. So please document everything. Okay? The evidential value is going to be based on what you have said, what these swabs are worth, what gets sent through, and what kind of conviction we can actually get for the case is going to be based on what you have said. And remember that there is a DNA database. There are a lot of people who worked very, very hard and fought for many, many years to make sure that we get a DNA database. We have now got one in place. Despite our huge backlog, we have one of the most sophisticated DNA systems or DNA laboratories in the world. And our DNA database has been fought hard for. We also have the highest rate of serial rapists and serial killers in the world. So South Africa, winning at everything. So please, this kit is worth so much more than just the person sitting in front of you. It can go into that database and a lot of crimes can be solved and a lot of crimes can be prevented. Okay, please remember that the survivors of sexual assault need help, follow up, psychological support. There are a lot of NGOs and trauma counselors within all the different areas within the country. Please find out if there are any close by to the hospital you work at. Call them in, find out what their procedures are, work with them, be able to contact them if you need. This is one of Tears is one of the helplines for sexual assault survivors. Please use them if you do need. And these are some of the references.